Good evening, everyone. My name is Elizabeth, the Education Coordinator for Marlene's Market and Deli. Tonight's special guest that we have with us is Kate Esparza-Guerrero, and she's speaking on the topic of Medicare 101. Thank you so much, Kate.
Hi, welcome everyone. First off, as Elizabeth introduced me, some people know me as Kathleen, but I go by either name is fine. I'm an independent insurance broker, and I'm talking to you here from Des Moines, Washington, Normandy Park. And I've been in the insurance industry for several years, about 12 years. Before that, I was working as a paraeducator in the Federal Way School District, and while my children were going through school. And I also, then I went into the insurance industry, working with property and casualty insurance, where I was an admin and also was a sales support. So I got the taste of what private insurance was. And then when I ended up getting laid off right before I turned 60, I kind of had the rude awakening of, oh, it's kind of hard to find a job out there. This was about 5 years ago. And then I had learned about Medicare brokerage or being an agent working on my own, which worked out well because I have my dad that I help, and then I have a granddaughter now, and the flexibility to work from home. Several hours of learning and certifications, which all Medicare agents are supposed to do to be licensed in the state of Washington. Every summer, new training comes out because plans change and laws and rules change. So it's coming out just in another week. We call it AHIP training. And then whoever we as a broker want to represent, we certify with that particular insurance carrier, the private insurance carriers. And there are several private insurance carriers. Those are the ones that are mailing you all those letters. Those are the ones that are putting on the commercials that you see on TV and the phone calls that you're getting. Those are I'd say 99% that those are coming from the private insurance carriers. So don't panic for anyone that's coming new into it. As I myself am going to be hitting 65. There's a lot of 1957 baby boomers that are also coming in. And so I get those calls like, what do I do? Because it is very confusing. And I don't know why it has to be so confusing, because it's just, there's several steps that we end up having to go through. And that's why I enjoy my job, because it's the education part. And that's my passion, is educating. So there's no fee, no obligation when people meet with me. That's where my Medicare, the federal part, comes in and kind of like polices me, or not really polices, but we have rules that we're supposed to follow, and very specific rules, which I like. So there really isn't any soliciting that we're supposed to do on our part as independent brokers. And so that's why my presentation here, it is strictly a Medicare 101 presentation. I will not be presenting any private insurance plans. That will be left up to you to then, you contact me through email or text or phone call. And then I set up an appointment, and then that's where I can talk to you about the private insurance. But right now, I'm going to do the education part of the federal Medicare 101. And I will talk a little bit about the supplement and Medicare Advantage plans, how that incorporates with Medicare. Let's see, I have my little flip notes here. So we'll be talking about eligibility, enrollment period, supplement, Medicare Advantage plans, and for the upcoming 2023. So first, let's talk about the Medicare 101, and I call it the original Medicare, which is what we call it, the red, white, and blue. And I think I have a picture of the card for those of you. The card, it looks like this, and it's red, white, and blue. It's pretty easy to differentiate from any other card. So that is where people will be eligible either by turning 65 or through disability or special circumstances. And those of us that are turning 65, like in September, this is the month of June. If you are not collecting Social Security, which a lot I have found in baby boomers, they're still working, they are not collecting their Social Security. So then that person needs to initiate the enrollment. And you have 3 months before your birthday month. So I'm going to use my husband as an example. He's going to turn 65 in September. So in June, I am going to get him started on that enrollment process. And I encourage everyone, I would love to be able to say, how many people in here have an online Social Security account set up called My Social Security? I have learned a few years back from a couple of financial planners, I paid $25 for a lunch. I came out of there with the number one advice that I pass on to everyone, young and old. You definitely should set up a My Social Security account online so you can check the status of your Social Security. Social Security is not mailing out those papers that we used to get in the mail where we could see each year that we worked and how much we were going to get. They're not doing that. They really are pushing that they want us to go paperless. And it's a process. So, and I say it's a process because to do it online, you'll go to the Social Security website, and it actually asks you if you want to create an account. You'll create an account, and then it starts asking you questions of like, where you lived in your high school years. So it's stirring up memories and cobwebs, brushing out the cobwebs. So I tell people, have any paperwork or charge cards, things like that, at your hand, so that then when the Social Security is asking those questions online, you will be able to answer. Because I tried setting up my Social Security account for my husband, and he was in the other room watching TV. And so I was doing it online, and I asked him a question. He had a Goodyear account back when he was in high school, and he couldn't remember the year, and then he threw out a year. So I put the year, and then he goes, "Oh no!" And I went and switched to go back to change it, and Social Security then froze me out. So and it's good because Social Security is very cautious and security driven, that if they see anything that doesn't look right, they're going to freeze you out. And then you have to call. And that's a nightmare on calling. Don't call on a Monday. Don't call on a Friday. Don't call in the beginning of the month. Don't call at the end of the month. Call in the middle of the month and have your Kindle or a good book, because you're going to be on hold for a while. But so I'm going to have to do that. I plan on doing that this week, on making sure that I can go back online and get my husband enrolled, to have him create a My Social Security account. True story, I just spoke to a family member that I was helping her enroll her mom. Her mom had moved from Oregon, and she told me that her daughter's employer, REI, had recommended that everyone do that, create a My Social Security account, because of the fraudulent unemployment applications that were happening. And she ended up checking, and she found that someone had actually been using her Social Security. It took 1.5 years for Social Security to straighten it out, and it was up to $300,000 to $400,000 worth. So they were using her Social Security not just for herself, but also for other applications. So true story. I had been told or warned why you need to check. And then I was like, oh my gosh, I've talked to somebody where they were able, she said, can you imagine if she hadn't gone online to check? It could have been, who knows how long before she would have gotten a letter from Social Security, who knows? So that being said, so leaving that, so let's say you go, you create a My Social Security account. Perfect, you've got that done. Now you want to enroll in Medicare. Well, when it comes time to enroll in Medicare, all you have to do is go to medicare.gov, and then there'll be a spot that it'll say, I want to enroll in Medicare, that you only want to enroll in Medicare. And it'll take you back to the Social Security page. And then at that point, it asks, do you have a My Social Security account created? And then you're like, yep, you just click that. And then it opens up to where the actual steps in enrolling in Medicare will take you maybe 15, 20 minutes. But if you haven't done the My Social Security part, creating an account, then you're going to have to go through all those security questions first before you can enroll, because they're wanting you to create the account. So I'm like, do one thing at a time. If you're getting ready to retire in a couple of months, or you're turning 65 in a couple of months, do the My Social Security account, create it now. Okay, that's done. Now you're online, you're not collecting Social Security, you need to enroll, you're still working, you have employer group coverage. So you're like, I don't need to have the medical coverage, but you are eligible for Medicare Part A. Why are you eligible for Medicare Part A? Because you have worked 10 years worth, or what they call 40 quarters worth of credits of where withdrawal from your payroll check has gone into Medicare. So you've paid for it, but now you're eligible for free Medicare Part A, which is hospital. So let's say you're working, you have an accident, can be just, maybe you fall and you have to be admitted into inpatient, and you're in the hospital for a couple of days. Then it comes time for the billing. What the billing does is the hospital will bill your employer group coverage first. And so let's say your employer group coverage covers 80% of all charges, and then you're responsible for the 20%. Well, then that 20% will go to Medicare, and then Medicare will cover 80% of that 20%, and then you pay the remaining balance. So that's why I tell people, why not enroll in Medicare Part A? Because I've had a lot of people are confused. They think, well, I'm working, I don't need to enroll in Medicare A. You're right, you don't need to. Nobody tells you that you should, but why not enroll? Because you're eligible for it, and you can have that assistance if you landed in the hospital for inpatient. Okay, so you're going along, and I'm talking about, let's say right now, the scenario of where you have turned 65, you're working, and so now let's say you're going to retire come in 2023. Okay, so what do you need to do to retire? You need to get, there's 2 forms called, they're specific forms. I have them. You can also get them online. And one form goes to your employer, and your employer then fills that out. And pretty much what Medicare is doing is they just want to make sure that my husband's name is Tim, that Tim had credible drug coverage and medical coverage from the day that he turned 65. I mean, they care, but they don't really care what type of coverage you had before you're 65. They just want to know that you've had credible coverage, and COBRA does not count as credible coverage. So, and also it takes, it's like the employer, I think if it's a small business, if it's less than 20 people, then that's not credible coverage. So you need to really check with your HR on that. But so back to the scenario where you've got your employer group coverage, and now your employer is filling out that form. Really basic, easy. They're just putting the dates of when you started with a company and that let's say you currently are still covered. Then they give you the form back. Then you fill out your form. You just put in your information, and then there's a section on the form that asks, will you write in the date of when you want your Part B to begin? So if you wanted it to begin in November 1st, 2022, you would write in, I want my Part B to be effective November 1st, 2022. You take those two forms, make a copy, keep it, and then mail those two forms to Social Security, your local Social Security. And then you will be able to go online to your My Social Security account, and you will actually be able to check the status of what's happening with that enrollment. Hopefully you get a card in the mail in a couple of weeks. It depends on the time of the year. Holiday time is the worst time. It can take a really long time. I've heard there are now some smaller offices like in Arizona that are helping Washington State because of the influx of just a lot of baby boomers aging in. So you get that card, and it'll have your Part A and your Part B effective date. Now, for someone who maybe turned 65 2 years ago, and it'll have the Part A of when that person enrolled, and it'll have that date of 2020. Then for Part B to begin November 1st, it'll show Part B November 1st, 2022. So there's a lot of people that have that red, white, and blue Medicare card that shows the two different dates. Okay, the Medicare. So Medicare covers 80%, and then you are responsible for the 20%. It doesn't seem like that big of a deal, but then yet it is, because there isn't any ceiling. So the cost could be astronomical, which is why we have all those private insurance carriers out there that fill in to help you with that 20%, so that you aren't left with having to pay this huge amount that is 20%. So back to the enrollment. So your enrollment when you're going in starting 65, we call that the initial enrollment, IEP, and of turning 65. So it's 3 months before your birthday month and 3 months after your birthday month. I recommend you don't wait till after your birthday month, because if you wait a month after your birthday month, then your effective date isn't going to be for that following month. So it could be a couple months out. So I recommend doing it the 3 months before your birthday month. That is if you're not collecting Social Security. Now, if you are collecting Social Security is going to automatically send you that card. Again, if you do not want the Part B, you need to either call Social Security, make sure that they know that, or go online and make that note that you do not want Part B, because once you are enrolled in Part B, you're going to have to start paying that monthly premium. And you don't want to have to start paying that monthly premium before you have to. Okay, enrollment periods. So I'm going to kind of like, the next enrollment period is the AEP, which is Annual Enrollment Period. That is for people that are already enrolled in just original Medicare or a Medicare Advantage plan. It can be across the board that people can enroll. You have a chance to change your plan from October 15th through December 7th. Okay. There's no underwriting. You can change your plan. And we as agents start to learn about those new plans like in about September or the beginning of October. And also that's when the cost of living adjustment, or what we call COLA, That's when we start to hear that the Social Security payments are going to go up as inflation. And once the COLA amount has been set, then we typically learn what the Part B premium is going to be. And that Part B premium has gone up. It goes up a little every year. For 2022, it is at $170.10 for the Part B premium. So yeah, there's the red, white, and blue. And the Part B premium, that is your medical, okay? The medical that's going to cover everything else outside of the hospital. Physical therapy, your physicals, your annual checkups, all of that, everything, even outpatient surgery comes under Part B, okay? And then that's where you're gonna start paying your monthly premium. Now you can go onto Medicare.gov and there's a section in there that it says costs and it'll say Part B cost. You can click on that and it'll show you a table. And what the federal does is they look at what your income was from your taxes 2 years ago, and based off of that is what the standard Part B premium will be. The majority of us fall in that category. For those that are in a different financial bracket, it then changes. That's where you go, you can check that table, and I help people with that as well. Let's see. Then open enrollment. Open enrollment is from January 1st through the end of March. Open enrollment is just for people that have Medicare Advantage plans. That means, like, let's say somebody had an enrollment, they enrolled in a Medicare Advantage plan during annual enrollment. And then after they've enrolled in that plan, maybe their doctor isn't in the network any longer, or they want to change to a different Medicare Advantage plan. That's the time when they can do it, from January 1st through March 31st. And also they can get off of a Medicare Advantage plan and go back to an original, just original Medicare without any other plan. Special enrollment. Special enrollment, if you move, you have a change of financial status, that you need help, state aid help, a chronic illness diagnosis, and then change of a job, retirement, that all comes under SEP. And SEP means it can happen at any time during the year. I've done several SEPs with this last 2 years with the pandemic. People just like, I'm out of here. So let's see. So that was the SEP. And then we talked about Part A for your federal. Part A has a deductible, and that deductible is $1,556. That means when you go into the hospital, that $1,556 deductible will be part of in the billing, that you will pay that first, after what Medicare pays, the 80%. And then that's good for 60 days. That's considered a benefit period. So then 3 months down the road, you go back into the hospital, you have to pay that deductible again. Okay. Let's see, what else for Part A? That's pretty much it with the Part A. Then Part B, there is also a deductible. That deductible is $233, but that's annually. So that's just once. So once you pay that deductible, it's done for the year. And then you have your Part B annual or monthly premium. And it doesn't matter what plan you go with, you will always be responsible for paying that Part B premium. The Part A and Part B, the original Medicare, the red, white, and blue, does not have a prescription drug plan. So if you were a person that just wanted to have your original Medicare, you would have to have a drug plan, a separate drug plan that's not offered through the federal. It's only offered through the private insurance carriers. And those plans, the national average is, I think it's $45. So that is what you would be paying monthly along with your Part B premium. So that being said, then everybody's like, well, okay, what about, some people say I have a supplemental plan or I have a gap plan. So the supplemental and gap plans are literally the supplemental, they're called supplemental because they supplement that 20%. Now, supplemental plans are through private insurance carriers, and they do not have networks, meaning you can go to any doctor that, as long as that doctor accepts Medicare, you can go to that doctor. There isn't any requirement that your doctor has to be in that network. And there aren't any copays. So it's just that straightforward premium that you would be paying for that plan. So you're like, well, what plan would I pick? Well, we amongst the carriers, we call that the alphabet soup plans, because that's where you can, some people talk about letters, like I have a plan F or I have a plan G. So the plan F, that used to be the favorite plan. As of a couple of years ago, people are not allowed, they're not permitted to enroll in those plans. People that are enrolled in plan F plans still have them. It's just that they're not taking any more plan Fs. The popular plans are plan G, and then there's what we call a high deductible plan G and a plan N, as in Nancy. And those seem to be the most popular. And those plans are the same. Doesn't matter which carrier you enroll with. It can be with Humana, it can be with United Healthcare, it can be with Mutual of Omaha. That coverage is the same. You can look at a book from Humana and a book from United Healthcare, and their plan N, it's the same. What the difference is in the premium. And it can be varied from $10 to $30 on how much that premium is for plan N. So obviously when I work with people, I typically encourage the carrier that has the lesser plan N or plan G. And there isn't a maximum out of pocket for these plans, because it doesn't have to be. If you have to have outpatient treatment or surgery twice a month or 3 times a month, you can. There's no limit. Okay, so you do the math. So you think about, so if you're writing down $170.10 is your Part B, you have to pay that. Then there's a plan N, and I'll throw out one from a carrier, $163. I don't know the cents, but say $163 for the plan N, the supplemental plan. And then the supplemental plans do not have drug plans. So you're going to have to get a drug plan. So let's add in $45 for the drug plan. So there you're, $380, $390, close to $400. Now, for some people, they're like, I was on the Washington healthcare, people were paying through the Washington healthcare plan. They're like, that's a lot less than what I had to pay. Some people are paying $600 to $700. So they're like, I don't have any problems with that. That's great. And also the supplemental plans, they take care of all those deductibles. Okay. The deductible that I told you about for Part A and Part B, it takes care of that. You don't pay any of that. So then you're like, so what's the big deal about the Medicare Advantage plans? That those are all the commercials and the flyers. The Medicare Advantage plans, they include your prescription drug plan. Okay. And it does depend on the plan that you go with, because depending on the carrier and the plan, you can have a plan that you don't pay anything. You pay $0 per month. And then you can also have plans that are maybe $88 a month or $45 a month. But you have a choice, and you can look through them and research which Medicare Advantage plan works best for you. The drug plan is also included in on it, so that then you don't have to have the separate. So when you're looking at the cost, you have $170.10 plus the Medicare Advantage plan. Say you go with a choice plan or a platinum plan or whatever, and that plan is $0, and you don't have to pay a drug plan. So that's literally what your cost is going to be per month, $170.10. So what are the limits? It's, you have to go to a doctor that's in the network, and don't let that scare you, because the network for a lot of these carriers is very big. University of Washington, Polyclinic, Valley Medical, St. Francis, they all, and I can tell you that what one carrier has for the network typically is in the other larger carrier. So I have found when I'm looking up, what I do when helping people, I get the list of their specialists or their doctors, and I look them up and find if they're in the network. And then I take the list of medications, maybe it's 1 or 2, and find, which plan has a $0 copay or a $3 copay to pay for that medication. And when I bring up the word copays, that's what the medical is with the Medicare Advantage plans. When you go for a primary care appointment, it could be $0 copay. If you go to see a specialist, it could be $45 copay. So there are copays, and you're wanting to go with the network. Now I can tell you, I have maybe 6 people total enrolled in a supplemental plan. Everyone else is on a Medicare Advantage plan. And the Medicare Advantage plans, they have a maximum out of pocket, meaning as you're paying copays, you would never reach that maximum out of pocket. The only time you would reach it is if there was an accident, or if you're diagnosed with a chronic illness. And at that point, after several months, when you do reach that maximum out of pocket, the carrier pays the rest, pays 100%. Okay. So that's pretty much it. I wanted to open it up for questions. I don't know if Gail is still with us. I didn't want to go too in depth about the prescription drug plans with formularies, because that's just, it's unnecessary. I mean, I can go over that in detail with people one-on-one, but it'll put you to sleep. So, but yeah, any questions?
Don't be shy, folks. Feel free to enter in the chat box.
Yeah. I don't think I've left anything out. The Medicare Advantage plans. Medicare Advantage plans, yes, they have the extras, the acupuncture, in which a lot of my clients that I've helped from Marlene's, I get several people that'll say, I don't have a primary care. I go to a naturopath, or I don't need a drug plan. Well, the Medicare Advantage plan, that's the ideal plan, because since the drug plan's already immersed in it, you're not paying any extra money. You can have a $0 per month, or you can have a $35 per month medical plan, and it just happens to have the prescription drug plan there with it. And who knows, you just can't tell in the future what can happen. But the chiropractor, the acupuncture, the massage therapist, those are the extras that Medicare Advantage plans offer. Dental and vision, those as well. As a daughter of a dentist, a mother, a mother of a daughter who's a dentist, I can tell you I've learned a lot from her. And what I can tell you honestly is there aren't any dental plans out there that are going to equal to what you have from your employer group coverage. So for anyone who's thinking of retiring, use up as much of your dental as you can. Now, for the Medicare Advantage plans, there are some plans out there that maybe have up to $2,000 coverage. And then there's some plans where they have riders that you can add on once you've enrolled into a plan. But it's typically not, it's $1,500 to $2,000 for a year. Okay, that's it, I think. I know it doesn't seem right. There needs to be more money put towards that. And Medicare pays Medicare Advantage plans stipends for each time a person enrolls in a plan. Then Medicare pays a stipend to that insurance carrier, and so that pool then gets bigger with that money that then these carriers can offer more. I saw in legislature that there was a bill on trying to add more to the federal Medicare for dental, but it didn't pass. So when I heard that, I'm like, it'll be interesting to see what 2023 carriers offer, but I'm not too hopeful. So,
Yeah. Well, thank you so much, Kate. So I actually had a quick question. So for someone, so the initial enrollment, you know, the 3 months before or 3 months after, but you had suggested 3 months before, just
Yep.
in case. Could those people put forth for the Advantage plan, like with their first enrollment?
Yep, they sure can.
Wonderful.
That's right. Good question. So once a person has started the process of enrolling into the federal red, white, and blue original Medicare, once that person has their what we call MIB, Medicare individual beneficiary number, used to be Social Security number, now it's a unique number. Once you have that number, which is on your card, then you can enroll in a Medicare Advantage plan. And because you can't enroll in a Medicare Advantage plan until you have that number. So yes, I've had people that they go ahead and they enroll, and then it's effective the first of their birthday month. Unless you're born on the first of the month, then it's effective the month before.
Oh, see, there you go, folks. For those of you who are born on the first.
Yeah, I have one person that did for them, that it worked like that for them.
That's
so
great.
yeah.
Yeah, I was yeah, it's really interesting with all the different dates you know, for enrollment periods, but I'm so grateful for your knowledge and expertise in this, because it makes a lot more sense to me.
Yeah, and I just spoke with my husband. He drives a truck and makes deliveries. He goes, "Hey, I've got this lady where I deliver to. She's worked for this company for 30 years and she's really struggling with the Medicare." So I called her. Well, her birthday was in March and she's just now getting ready. And luckily she's still working, so she has her employer group coverage. So I told her, don't worry, you're not going to get a penalty, because if you go more than 60 days past your birthday month, then you can start, and you don't have that coverage, you can get penalized. But she has that coverage, so she doesn't have to worry. But she's like, oh, I'm thinking about retiring. So of course, what did I tell her? Create a My Social Security account, enroll in Medicare Part A now before that 3 months is up, before this month is up, because she's at the last of her third month. Otherwise, she has to wait to enroll in that Part A. Yeah. So Yeah.
And that was the October 15th through the December
It's
7th.
actually, I think they make you wait until that following, like the January that following year. It's really weird. I have another friend that she wants to enroll and she's 67, but she's on her husband's employer group coverage. So I told her, get on plan A right now. Just get that part done first. And then when you decide, you don't have to scramble as much.
Exactly, because most of the foundation and the weight game is already over.
Yep. The seed's
Yeah.
been planted.
Oh, and Natalie had a quick question. Why do so few enroll in the Medicare Advantage?
Well, I don't know about so few. Well, so the people that I have that have enrolled in the supplemental plan, they're just like, I don't want to think about having to find one person didn't have a primary care and they were like, I don't want to have to deal with finding a primary care. Granted, you can go with a DO, doctor of osteopath. You can go with a physician's assistant, because I've helped people pick one out to be able to enroll. They just don't want to have any copays. And I don't know, it seems to be most people, at least on my end, most people, I'd say 90% have wanted to go with a Medicare Advantage plan, because when you look at the financial part, you can be putting away that money that you would be spending on a supplemental plan when you multiply that much times 12, because it really does come down to where I'm sitting with people and we write out the cost, and then it's weighing out, well, I don't want to have to pay out all this money every month. I'm not really needing to really use it. And when I do need to use it, that insurance carrier will take care of me as well. It's that maximum out of pocket is not a deductible. That's one thing that people get that mixed up. It's not a deductible. I hope that helps answer. But yeah, majority, it's they don't, and they financially, say, I just don't want to have to think about it.
And so the Medicare Advantage is different from those supplemental ones, and then the drug plan is underneath those supplemental plans, like as its own.
Yeah, the drug plans. So let's say let's say there's an Aetna drug plan, and then there's an Aetna Medicare Advantage plan. The drug coverage is going to be the same in the Medicare Advantage plan. I'm throwing out tier 1. A tier 1 is usually a generic medication. And let's say on the Aetna pharmacy drug plan, the copay is $3 for amlodipine. It's a blood pressure medication. In the Medicare Advantage plan, the amlodipine is going to be that same $3 copay. The supplemental plans, they cover the Medicare Advantage plans and the supplemental plans. They're under the umbrella of Medicare, right? So, and credible coverage is the main thing. So it doesn't matter if you're on a supplemental plan or a Medicare Advantage plan, you cannot have a private room when you're in the hospital. You will have to pay extra for a private room. Doesn't matter if you're on a supplemental plan or Medicare Advantage plan. Or I have a lady that she was checking into having, I mean, without sounding too gross, but her toenails removed because she had fungus thing. And the podiatrist said, well, we can remove the toenails and have them regrown. So she asked me, will Medicare cover that? And I said, I want you to check and make sure that that's considered credible and that Medicare will cover it. Probably not, But before you elect to go forward, you want to make sure. And it doesn't matter if you're on a supplemental or you're on a Medicare Advantage plan. Medicare is the umbrella or the overseer, because Medicare is also telling the Medicare Advantage plans, you have to cover like the diagnostic, like colonoscopies, mammograms, all of that is also mandated with the Medicare Advantage plans as well.
That's great. And so if,
oh, go ahead.
oh, and then so if someone were just on Part A, that wouldn't be covered.
Correct. Because that's all outside of the hospital.
Oh, yeah.
Yeah. Part A is just inpatient. Everything that happens in the, once a physician has admitted you, that's the key. Because I noticed in some billings, there are some people when they have been in the ER, and then they were just like, gosh, but I was moved into a hospital bed, but it wasn't until they're still considered outpatient until a doctor has actually admitted. And I learned that doctors don't sign off on it until they have an actual diagnosis. So, you know, it can be a stroke, is like, that can be where they're trying to figure out what type of diagnosis. So you can still be considered outpatient, even though you've been put in a room.
That is good to know. Thank you so much, Kate.
The billing can be, and it's getting better. I've noticed from my end when I receive bills from like the University of Washington for my dad or my husband, they're getting to be very, very detailed. And they even talk about out of network and in network. They're letting people know that when you're in the hospital, you could be seen by an out of network doctor, and that changes the coverage.
Mm-hmm. Well, that's really good that they're spreading that awareness. So then, you know, that'll kind of give the patient some time to think, and then, you know, moving forward with their health.
And the hospitals, I've and several of my clients who have talked to me, when they've reached that maximum out of pocket, hospitals are very they're not there demanding their payment. They work with the patient. You know, some hospitals are better than others on that, but they know. It's just the cost can be too much.
Definitely. But that's what's so great about, you know, having this resource, especially for, you know, those baby boomers who are moving up in age, and then because we want to keep everyone healthy and happy.
Yeah. Well, and the medications, that's the network. So I have a network of other agents, that colleagues that I reach out to, because that's the disadvantage of working by myself, is that I don't have someone that I can talk to over my shoulder about something. So I've learned so much from my own clients. I really, everyone has a wealth of information. And then my colleagues, I have one who he's great on helping find like grants for medications. There's some people that have certain really expensive medications. So, you know, there's actual grants from the different pharmaceutical companies that you can apply for, or depending on the illness that you've been diagnosed with. So I've been learning about that, because unfortunately it is the medications that can just be astronomical. And, you know, like in Bellingham, where you can mail order, I have some women clients for hormonal creams and also eye drops. They use through a mail order. They don't even use their insurance, because depending on the tier of the formularies, it can be a lot more expensive, because that medication comes under a really high tiering.
Yeah, I actually experienced that with my own health insurance company, and was able to get it mailed to my house for super cheaper, hundreds of dollars cheaper.
Yeah.
Yeah.
So yeah, that's why I love this group that a friend, a really good, her name's Elizabeth as well. And she's been just great on connecting me with some of the other agents that have been able to steer me towards like the grants on helping out people.
That's very cool. Oh, yay. And for any listeners on Facebook Live, I had put Kate's contact information in the chat box or in the comment box. And you can reach out to her if you're interested in that information. So
Yeah, and you can text me as well.
perfect. Yay.
Let's
Yeah.
see.
Do you have
I
any
don't
more questions, folks?
see what else was I gonna like something. Um yeah, I mean, this is just like my mother-in-law who's gonna be 95.
Oh my
She,
gosh.
I think about people. She's a retired postal worker who years ago, was on the postal worker healthcare plan. And then a private insurance carrier contracted with them. And so anyways, somebody from a call center from the insurance, they called and they put her on that plan, which was fine. But customer service isn't really all what it used to be, and something fell through the cracks. And anyways, the credible drug coverage, that part was left out in getting that information from one carrier to the other carrier. So then Medicare was seeing that she didn't have credible drug coverage. So they mail her a letter saying that an LEP, meaning late enrollment period, was going to be attached to her 170.10 Part B premium. And it was as much as $54. And my dear mother-in-law, she was just like, what do I do? What do I do? She didn't want to show any of her family members. She says, I just want to talk to Kate. And so I saw the letter, and long story short, it's been a nightmare. By the time she told me, and by the time I called and then sent a letter, then Medicare saying, oh, it's past the 60-day window, so the case is dismissed. We won't even look at the case. So then I wrote another letter, literally, and I told my mother-in-law, I said, look, we're really going to have to play this up, that you really, she has loss of hearing. I said, but I'm really going to say you're severely disabled. You're, cognitive. And she goes, that's okay. Because it's just like, I had to plead my case to like give this lady a break. So I'm waiting to hear back from them. They called and left a message and said, it's a different department now that it goes to. It's something like reasoning on why case dismissed. I kid you not. And it's somewhere in Florida where I have to mail this letter to.
Oh my goodness. They're kind of giving you the runaround.
Yeah, but it just makes me more passionate about what I do, because I think of all the people that don't have someone in their corner helping them. And where my mother-in-law was just ready to pay that check.
Exactly. But
Yeah.
If you call on Kate here, she'll be in your corner to help you throughout all this Medicare. And
For sure.
yeah, we could call it a Kate to care because she
There you
cares.
go. Yeah, I even kind of joked around. I said, gosh, if they push back again, I may just go to the news on this one, because this is really bad.
Yeah, I mean, how many other, sweet elderly ladies have they, pulled the wool over their eyes, and they, don't know.
Yeah, and I think, like that's what my husband was saying. I don't think it's really being wool pulled over their eyes. I just think it's a bureaucratic part where things have fallen through the cracks, and because of customer service being I mean, we hear it all the time. There's just not enough workers. And so there's people, they're short staffed, and then the staff that they get is newly trained and not really knowing what they're doing. I think that's a big problem right there, unfortunately. And it just needs to be, I don't know, brought to the spotlight to where then somebody's like, oops, we need to really fix this. So we'll see.
Well, fingers crossed for
Yeah.
for your mother-in-law.
Yeah, she's turning 96 next week. So,
Oh my goodness. Well, you tell her happy early birthday.
right? Yeah.
Aw. Well, thank you everyone for watching Facebook Live, and reach out to Kate for one-on-one appointments and questions.
Yep. Thank you, everyone. It's
Have a
been
good one.
Bye-bye.